If you really want to do a really good job for you and yourself, just immerse yourself with a network of people, tap into something.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Kaylie McCrory. Kaylie is a biologic coordinator at Bayer Dermatology and also the founder of NTX Biologics and Consulting. Welcome, Kaylie. Thank you for joining me.
Hi, thank you for having me.
Yes, I'm so excited to chat with you and to hear about your experience. It's always good to have another bio coordinator on the show just to chat and, see what similarities we all have in common. But I'd love to hear from you, like, what got you into dermatology in the first place and being a biologic coordinator?
I've been in healthcare for 15 years. And in 2018, I landed in a med spa. And I also have family who work in med spas too. So that kind of piqued my interest. And worked with my cousin for a little bit, did scalp injections. I'm also a certified laser hair technician. So I do some things on the side outside of my full-time job. And then after that, I decided to pursue full-time dermatology, landed in derm. And how I came a biologic coordinator was the first derm office I worked for. No experience at all. Learning systems, especially mod med, was interesting. And dermatology is definitely different from all the other specialties I worked with. So they had told me I was never going to make it in healthcare, in particular, doing what I was doing, just learning logics. But they had told me we send everything over, so you can't do it. That's when they told me I was never going to make it, and they let me go. So I landed my next job and they needed a biologic coordinator. So when somebody tells me no, I want to know why they think I am not capable enough to do a job. I'm very capable. So I was like, it was something I had to prove to myself. Mm-hmm. And so when I took on a job with a provider, it was just him and another provider. And so they needed a biologic coordinator. And I said, absolutely, let me do it. So I did and loved it. I had no idea what I was doing, matter of fact, but I loved it along the, learning the journey through that experience in that year. Heavily relied on my reps, from everybody from sales reps to especially my reimbursement managers. They would come in and for an hour and just sit down with me. We would go cases, how to do some things, what's needed to get the patient on bridge. I didn't even know what a bridge program was. So I heavily relied on a lot of people just to get me through that job with that particular office. And they were the ones who identified, hey, you should look into this. You're really good at it. So, and then I fell in love with biologics because it's such a niche job that not a lot of people don't understand this position. So that's how I got into it.
Yeah. So do you think that office that told you that you weren't going to make it as a biologic coordinator, do you feel like they just didn't understand the role itself? Because it sounds like they were just kind of pushing everything out and they didn't quite know like how to manage it.
So after I left, I found out they had a dedicated bio coordinator, well known, matter of fact. I did not know any of this. You don't know what you don't know. And I remember it was a baby, full blown atopic derm, fully covered. Parents tried everything. And they're like, we're going to start on Dupixent. Well, at the time, Dupixent wasn't approved for 6 months or older. Then it became off label. Like, I'm sending it to like a regular pharmacy, not knowing anything about biologics and how differently biologics are handled. So they kind of went, nope. So I immersed myself with creating a network, and that's what anybody and everybody should do. Doesn't matter your role, whether it's a biologic coordinator or a medical assistant. If you really want to do a really good job, not necessarily for the practice, but for you and yourself, just immerse yourself with a network of people, tap into something. I live my life by intention, and everything I do has to have intent behind it, or it means nothing to me. So every move I make, every decision I make is very well calculated, and it backed by intention with wholeheartedness.
Yeah, that's so important, especially as a new coordinator or just learning in general. I mean, I've learned that you're not ever going to be perfect at this role. There's so many changes that are happening. You have to be able to adapt and you have to be able to change and to know that, insurance changes regularly. There's new drugs that come out regularly. The process is going to change. So we have to be able to adapt to that and know that my way is not the only way to get it done because there's multiple routes of getting the patient access. It's just being open and willing to continuously learn. And like you said, have your connections. That's huge. I feel so strongly about having the connections, especially as a bio coordinator, because what we do is so very specific and there's so many small details and things that, maybe an experienced bio coordinator may not know. There's some things that we don't know, so being able to collaborate with other coordinators that are in that space that are doing the same things, maybe they've come across something that I've never come across, especially when it comes to insurance companies and how they're changing formularies all the time.
All
So
the
that it's so important.
I have a lot of multi-states that surround Texas. So I've had to immerse myself in criteria with Oklahoma, Louisiana, Alabama, and then having that appear a connection in these states. If you deal with multi-state coverages and, patients coming in from another state, you got to learn that too. And that's also changed your state criteria. So, you know,
Hmm.
having connections is very important, and tapping in to a network is very, very important in this job.
Yeah, absolutely. So tell me about NTX Biologics and Consulting. Tell me what it's all about.
I started that in 2023, initially as just to generate some side income. I'm a single mom of a little boy who's 8 years old, who's actively in sports and academics, and that costs a lot of money. So I needed another way to support myself and him. And that's where North Texas Biologics and Consulting was created. So I did that initially to help other specialties that really have someone primarily focusing on prior authorizations. And I noticed, they're all doing these prior authorizations because the GLP-1s are such a hit right now, and they needed help because their office was so busy. So partnered with them. We did a 6-month contract and it worked out great. I got them set up in success. So it was a 6-month term,
Hmm.
and they're thriving. Their MAs are trained. With that, we do, like quarterly or every 6 months training, depending on the needs and if there's any turnover in that office. So I do maintain that relationship. So I do everything from finding solutions to help an office get on board with the process. But then it's more, North Texas Biologics and Consulting has primarily turned into consulting. So now I do that on the side outside of my full-time job. I partner with big companies to recreate designs of how things look, how they're presented to the public, or just to access and reimbursement managers, whatever that may be. So those are, sometimes it's an hour consult, sometimes it's a month-to-month consult. So that's been fun too. It's just speaking for some of these companies that we do, and then on the back end, I'm seeing, well, this may be changing. So,
Hmm.
it's nice to be a part of that, and it has purpose. So that's where that has streamlined from. It was created because I needed help myself and my son.
Hmm. Yeah. I mean, and it's so important though, too. I think for a large company, medical office in general, to have that support from somebody who's knowledgeable, that understands the process, not only on the office side, but on the patient side, because we do a lot with patients. And, in a way, a biologic coordinator, I always explain it as we're the liaison between the office, the patient, and the insurance company.
Yeah,
But we're also patient advocates.
yeah.
We're advocating for our patients. We're helping our patients become their own advocates because we know, how to get them access to the medications, but also we're looking out for affordability. and making sure that they're able to get it at a reasonable price at a time frame that should make sense, not waiting months on end to get their medication, which is seems like has been kind of the norm for a lot of other places. And you can see the frustration on patients, especially when, if they're coming from another office or something, which kind of puts in, what you've been talking about is transfer of care. And I want to get on that topic because I think it's so important when we see so many patients coming from different offices and those expectations. I had a podcast episode with a patient not too long ago, and we were talking about how she had gone to multiple different providers, and the experience was just starkly different at each one until she was able to find one that was actually there to educate her and give her the information that she needed and to help her, really just advocating for her. And that is so important. But tell me about transfer of care and why that is so important to you and why it's so important in general.
It's important in general because, again, in my 15 years of being in multi specialties across the board, but more so in the last 6 years, I've honed in on where healthcare is lacking. And for me, when I was a medical assistant on the floor and a patient was telling me, "Oh, I've tried this and that, it should be in my chart." Well, no, it's not. Where is it?
Mm-hmm.
And so I didn't know to look in medical records that were requested if they did that ahead of time. So I've been big advocate. I've spoken on transfer of care at some conferences. I'm just passionate about it because it's something that's not talked about. I have found in almost every clinical setting, while we may request the records, we're not updating the patient's chart in our system to reflect those previous records. So for me in biologics, I want to know comorbidities. I want to know previous medications because I'll help you in your case as you're fighting the insurance. So when I came on to Bear at the time, we were just 3 offices and like 4 providers. We have now grown to 13 providers and we just opened our 9th office last month. So in two
Wow,
years.
that's amazing.
So the growth that has came with my offices, it has come a protocol that if the patient comes in, well, I was at so and so's office or I saw this dermatology last year, that is a trigger word for my staff to, all right, we need to get medical records. Kaylee's going to need this information. This is her ammo kind of thing. So the more ammo you have in your gun belt or whatever toolbox, or however you want to word it. I'm from Texas, so we're big here on guns. Just the more ammo you have. I mean, it doesn't even matter what type of prior authorization is. I've got prior authorizations for tacrolimus that I want to know what other TCSs they've tried. So
Mm-hmm.
we had some providers come from one office in particular, and we had the patients follow. And so those girls, the medical assistants, knew to request those records. And I saw that. And I was like, these girls are on top of it. They know what we need. And which I was like, all right, we need to make this a protocol. And so that's where that came from. And that my passion for transfer of care is from was we had all these patients coming in. They had a long history with the provider, and I needed to know this information, like what all they tried and failed. Because while we know they went from TCIs and TCSs, and now they're on a biologic, well, they may have an insurance change from when they left that old office, and now they're with us. And now the new insurance plan has new criteria. I want to know baseline BSA. These are things I nerd out on and I geek out and I include it in my sticky note. So for me, it's a lot of extra work to do, but I've mastered it so quickly. I'm doing it in minutes.
Mm-hmm.
So I think that one time I had a patient had 250 pages of medical records.
Wow.
And I went through every single page, medical history, surgical history, previously tried and failed with the dates. I mean, I decorated it. And I use ModMed so we can write whatever. So I have this template that I use, and part of that template is failed medications. So
Mm-hmm.
I will do everything that they have, and I will, every time I touch that patient's chart, I'll go and check medical history again to see if we've sent anything for atopic derm or psoriasis, whatever the case may be, and I'll add it to that sticky note. So I have a running log of tried and failed medications that is
Hmm.
current. And that's what I use. And that's how I could just copy and paste it and submit it into the prior authorization. So for me, that works.
That makes such a huge difference. I mean, do you feel like your staff now is very familiar with that process and it's easy for them to update that as well?
Yes. They love it because they can be in the room with a patient and they can see, oh, Kaylee, I'll change the date. Like if I'm touching the prior auth, I'll change that pending renewal. Oh, Kaylee's already on this. She's good. She'll call you. Yeah, they've all been trained where to look for information, especially when it's a new note. Copy that and paste the failed medication in each current visit note. We do have a residency program too, so it helps with the residents with their notes too, because they're acting as the patient's provider. So we've got residents being trained on how we do biologics.
Yeah. I think a lot of times people fail to realize that the documentation is the foundation of getting a patient their medication. It's so
Yes.
crazy because a lot of times I see so many chart notes that just are having so much missing information, and then they're wondering how come nothing ever gets approved.
Yes. Yes. And that's a big problem. I mean, and teaching residents and like, you're going to be a new doctor, you're going to have your own practice. These are the things you need to look for when you hire a biologic coordinator and when you do your notes. You're going to be the one signing off on who's scribing this. You want to make sure that they have everything that they need. Like I push height and weight left and right. My team is tired of hearing me talk about height and weight because I'm getting prior auth on a medication that doesn't even require weight and they're asking for the weight. And you have to enter it. It's a required question. So I think it just, to your point, it comes back to documentation, and the better documented your note is, the better your chances of an approval are.
Hmm.
Um, we've got best practice of documentation, and that's just one of Baer's protocols. Is this is how I have such a high approval rating across the board on all biologics at all offices. I'm very proud of how I've gotten each office there. So, and
Yeah.
it's a teamwork effort. It's not just me. We have trainings. We have we have a lot of work that we do outside of the clinic, and I'm grateful that my teams are very receptive to what I'm trying to improve and how not only just for their patients but make the MAs better too.
Hmm. Right.
Because if these are great, then you're going to have a great staff. You're going to have happy patients, and your success rate overall as a practice, you're going to generate revenue. So I consider this to be a management job. I have
Hmm.
over 1,500 biologic patients. So it is a management job because you are literally in patient care. I do it more than just prior authorizations with Bayer Dermatology. So, I mean, you just gotta, I just do things. And I mean, of course, I talk with my boss and we collaborate, and she's like, okay, do it.
Hmm.
If that's is going to be great for the practice, do it. I'll sign off on it. And so it's just having that communication with whether it's a clinical director, practice admin, whomever it may be. If you have ideas, don't be afraid to speak up on that and implement some things. So in implementing a sticky note in a chart, like a running log of medications, how easy, yeah, it takes 10 minutes to do, but it's done, and you just add to it as the patient seeing. I mean, it becomes easy.
Right. Yeah, that's so true. So, how do you help patients navigate those complexities with, when it comes to that transfer of care and making sure that you have all the accurate, updated information? Do you communicate with the patient and reviewing all of that information as well?
I do. If we are sending out the records request, I'm already on the prior auth. I need to do it. I'll call the patient, especially if their general term of patients tried topical steroids. Well, I want to know which ones. Insurances want to know specifics and strength
Hmm.
and trial dates. They want to know it all. So I'll call the patient if there's any information I don't have or that we didn't gather in the exam. I will call the patient, and if they don't answer, I'll submit with what I have. And if it comes back denied, and I'll talk to the patient again, and then I get the denial overturned. You never know when the patient's going to answer or not, and you got to work with what you got.
Hmm. Yeah,
So,
that's so
uh,
true. I mean, I've not really like specifically transfer of care, but I've touched on that before when it comes to documentation because I think it's so important when, you've got a patient, even because there's so much cross specialty, there's so much cross between dermatology, rheumatology, allergy and asthma, ENT, like all of those different specialties. And what happens if you don't have that good documentation in the notes and now the patient is being transferred even to another dermatologist's office? Patients move all the time and they might have to see another dermatologist. So having that information up to date is so important. And I think there is such a lack of that I've seen, even coming from other specialties. A lot of it maybe is because they just don't know. But now we're in the time where insurance companies, like you said, want to know everything. They want all of the details. And if you're missing things, you're going to get a denial. And it's frustrating.
It is, it's very frustrating. And I just try to be more proactive than reactive. If I've got everything, I'm like, you need to create a folder. Here are your tried and failed medications that I've discovered. Keep that running log going for your own.
Mhm.
So whether you stick with us or you go somewhere, you move to another state, you have this information. Or if you change biologics, you have, just add on top of it. So I do try to educate my patients in other ways that I don't think a lot of offices do. I'm a big advocate on, like I just said, creating a folder file, for yourself. Hey, this is what I've tried and failed. This is what this insurance is wanting, but now I'm changing, insurance and their criteria is different. I am very big on them advocating for themselves too. If I feel like when I'm submitting a prior auth and I'm going to get it denied, or it's going to get denied just because it's just a one plan, I'll go ahead and I'll let the patient know, hey, go ahead and call your insurance company because you've been on this medication 5 years. This is just a new one-off plan. It's not a big payer. Go ahead and do
Mhm.
your member submission as well. So
Yeah.
I like to give my patients their ammo for
Hmm.
patient advocacy on their own behalf. So
Yeah.
I just do a little more. I think some people say I do too much, not to say I don't think I'm doing enough.
Hmm. It's
Like,
important. I love that. It's so important to educate the patients to make sure that they feel supported, but you want them to become their own advocate and you want patients to feel empowered. You know,
yes.
Otherwise, we're just going to be doing everything. I mean, there's only so much handholding that we can do. We need to get them to the place that they need to be and getting them their medication. That's our job. That's our job to follow up with the insurance to get that prior authorization approval and to make sure we've got all of the necessary information. But when it comes to making sure that patient understands their condition, understanding how the medication works, understanding their cost, that's on their end. And that's what we're here to help educate them with and support
Yeah.
them through. But yeah, I love that. So you're also a speaker for a lot of companies. When it comes to you going in and talking to offices, what is something that really gets you excited about being a speaker?
Oh, everything really. I nerd out so hard. It's just I try to find at least one person because there's always going to be one person at these programs that does not know, they're brand new, they're trying to learn. I want to know what my audience is needing or where they're needing their help at. I'll get with my reimbursement managers to identify that, but I read the room. That's very important, especially when you're getting ready to start the presentation. I try to have my presentations, or I try to make them a little bit more interactive and
Mhm.
involved, because I'm also here to learn from them. And especially if it's in an out of state program, I want to know about y'all's state criteria. How different. I want to know how different it is from Texas.
Mhm.
Um, so I just try to engage, and at the same time I'm helping them, but maybe there's that one person who's trying to build their network, you know who's starting that journey, who doesn't know
Mhm.
about all these conferences, BCOD, ACBC, PAMS, Healthcare Advocate Summit. They don't know about these things. So I will just try to find anybody who will listen to me and listen to me be a geek, really, because that's what it comes down to. I just find it fun to educate, meet people, see where they're struggling. Maybe they're going to teach me something, because I'm always willing to improve my processes. Even if it's
Yeah.
just one button or of a switch, that's the change that can make a difference in somebody's day. It's an education and learning experience for everybody.
Hmm. Yeah, that's so huge. I love that. I mean, that's kind of one of the reasons why I love, not only just having the podcast, but also being a speaker as well,
Yes.
because you do get to connect with so many different people that are in different stages of learning. And, kind of hitting back to what you said before when you were just starting out and connecting with your reps and learning from them. And now, years later, there's so many biologics available and support that's available that you've got a whole network. You've got so many people that are available that are willing to help. Um, and I think a lot of it is it's not just the drug companies, it's not just the pharma companies, it's the people that are in those roles really care about the patients and they really want to help get the patients access to these medications because they are life changing. And I think that is the most exciting part is that we're in, the healthcare space because we have a passion for helping others. And, so that's what makes it exciting. I mean, you say geeking out, but at the same time, I mean, that's it's so much fun. You're right. It is. We want to learn everything that we can and absorb as much as we can so that we can know how we can best help our patients. And, whether it's somebody close to home that got you in this or somebody that has gone through something, a family member, because we all deal with insurance. We all deal with, having to get a prescription for something and go through the prior authorization process or cost and wanting to know how much it's going to cost. That we're all dealing with that. It's just understanding how to do it best and navigating that. But, the education is so huge. And I love that there's so many resources available now that really can help us get to where we need to be. And that part is really exciting.
And then none of these conferences and these resources that we're discussing existed when I was started. I
Yeah.
found out about BCOD until it was after their first conference. And then I was like, man, this would have helped out so much. And then I had to fight. I was not really fight, but I had asked my employer, I was like, I would like to go to the second one. And they said, no, we don't see the benefit in it. They didn't understand how important this role is. So I paid for myself to go. So these resources really didn't exist when I was starting out. So all these new coordinators or access coordinators or whatever their role is titled as, there's so many different resources to tap into and networks these days. And I mean, that was just 4 years ago when I started.
Hmm.
In just 4 years, and I've been doing biologic. I mean, the number of drugs that have came out,
Right.
and the resources, and just it's an exciting time, really, to be in this space in healthcare because it's growing. We have the biosimilars. I mean, we are constantly immersing ourselves in new education
Hmm.
and just going in it head first.
Yeah.
I mean,
100%.
all right, we're doing this. It's a new drug. Let's go learn about it.
Yeah. I mean, that's kind of what you got to do, you know?
Yeah. And that's like a new drug coming to market and navigating insurance. It's been a great experience. I'm grateful for all the resources that are out there now. And I've been fortunate enough to be a part of some conferences that I'm hosting and getting to learn that aspect of it and being able to actually talk to members coming in from all over the country and just meeting these people and just getting nerding out with them.
Hmm.
I feel like nobody understands our excitement and our passion in this role more than the people who do what we do.
Right.
When I'm meeting people, they're asking me, "So what do you do for work?" And I'm like, "Oh gosh, how do I describe this?" I recently I've just decided I'm a patient advocate and I fight insurance companies.
Hmm. In a
In,
nutshell, yep.
how do I summarize this? Because it's such a very extensive list that we do.
Hmm.
And so meeting you, meeting Shaylee, Heather, gosh, I can't tell you the number of people I've just tapped into just in a year alone. But I mean, I think you and Heather and Shaylee were like the first three people I met. And I was like, I don't know y'all, but I'm going to call you.
Right. I love that. Yes. So now that you are an experienced biologic coordinator and have so much under your belt, what's one piece of advice that you'd give to medical professionals who want to better support their patients when it comes to getting access to these specialty medications and biologics?
I will tell them, come sit with me. Come sit with me, or just tap into a network. I just get to know your reimbursement managers. Those are going to be, they're your best friend. Talk to mine. If I don't talk to them daily, I'm talking to them at least once a week. That's the best place to start. And then find 2 or 3 people that you can have them as your network that you can call if you have a hard case and discuss it with. Even though I'm experienced, I can't tell you the number of times I reach out to somebody. Hey, are you seeing this? How would you handle this? Like, it doesn't matter your level of expertise. You're always going to need help. Find somebody you can relate to, who gets where you are, knows where you currently are in your journey as an access coordinator, and just call them. I mean, bug the heck out of them if you absolutely have to, because if they won't, somebody else will. If they're not helping you, find somebody who will, because there are people out there who will help you. Don't just go for an answer. If you want to learn something, go learn it.
Yeah, that's good. Well, thank you so much, Kaylie, for joining me. And it's always such a pleasure to chat with you. And I'm sure we'll see each other at a conference at some point somewhere.
Yeah, this was fun.
Yes. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.